Now joining us from San Diego is Dr. Jay Doucet. He's a trauma, general, and critical care surgeon. He has 22 years of experience in the military medical service. And Jay, why don't we start there? Given the fact that you have that kind of background, obviously triage comes into effect here. Give us a sense of what happens inside these hospitals. They have to mobilize. They must know that they're going to see a lot of patients. How do they respond?
Yeah, thanks, Mike. Well, the hospital has to transform very quickly from routine sorts of business to looking after a large number of casualties and also dealing with injuries that they may not see very often now appearing in large numbers. So hospitals have disaster plans, and basically once it's realized that a disaster has occurred, like a large explosion, the hospital has to basically flip a switch and change its operations. And that could start with triage, which is usually done outside the hospital, and trying to sort patients on the level of severity so that the most severely injured patients are treated first.
And Jay, talk to me about the medical resources needed and what some of the concerns are. I mean, if you're inside that operating room and dealing with this onslaught, what are some of the things you have to start thinking about?
Well, there are two main issues that have to be dealt with. One is there's going to be a big surge in numbers of casualties, and that means that there are going to be patients that need to be treated more quickly. They have to be sorted out more quickly from patients that aren't so much. And then there's going to be injuries that you don't see very often or maybe not at all. And in an explosion like this, there's going to be a lot of people who have injuries from blast, which is not something civilian surgeons see very often. There's also going to be a large number of people who are hit with flying objects and cut or crushed by flying debris. And then there's going to be a large number of burns. And burn care is very specialized and very labor intensive, and that puts a great demand on a hospital.
And you were talking, we mentioned your experience with the military. In many respects, this is sort of like a military operation in that you mentioned it, I guess, shrapnel flying through the air, people hit with the type of things you might see in a battlefield.
Yes, the types of blast injuries we see vary from event to event depending on what the explosion actually was comprised of. But in a case like this, with chemicals, a big issue is going to probably be burns. But this looked like a pretty large explosion from what I could see of the footage. So unfortunately, people even at a great distance could be hit with flying objects, could be hit by glass. And closer to the actual event, there's also the possibility of people being trapped or crushed by falling debris or by collapsing buildings. So there's a whole variety of things that can happen. And many of these injuries will be very challenging. One of the problems the hospitals will have to deal with is how to bring in additional resources and how to mobilize additional resources. And in a large country like China, there's going to be a lot of resources available, but it's going to take time for that to get there. In the meantime, you have to sort of ration what you do for patients and can only do so much for each patient at one time, do just enough to keep that patient stable and alive until more resources can come in later.
Jay, we've talked a lot about the patients, but let's talk about the people who do your type of work, the medical personnel. Obviously, they know after something like this that they're going to be putting in long, long hours, don't they? I mean, how do you gear up for something like that?
Well, hopefully hospitals are doing disaster drills, and the first step for anybody who has to respond to a disaster, whether they're a first responder like a fireman or paramedic or for a nurse or a physician, is to recognize that these things can happen, and you can have a bad day that happens on any day. So once you kind of first recognize it can happen, that's the first step towards preparedness. There is specialized training and courses available. Our university and the College of Surgeons in the United States teaches special courses on disaster preparedness for healthcare providers. But probably the first step is just mental preparedness that this can happen and that you have to be ready to deal with it.
And the other question I have for you is people giving blood, that sort of thing. I mean, is that a concern that, what are some of the resources, you talked about resources, some of the things that you are concerned about that maybe perhaps you run out of?
Well, one thing, blood can be an issue, but very often blood is not the most important issue, and more likely the things they'll run out of will be mostly basic medications, burn supplies, dressings, that sort of thing. But you have to be careful on what's actually mobilized. If you get too much of the wrong thing, it can actually clog things up, and we've seen that happen in the past. An example in the U.S. is after a plane crash, somebody got on the radio on a DJ and said, go to the hospital and donate blood. It overwhelmed the hospital because that's not where you donate blood, and they couldn't get the ambulances close to the hospital because there were jammed with a traffic jam, people trying to donate blood at the wrong place. So there has to be a rational response to this. But the main problem most hospitals have these days is what's called just-in-time supply. A hospital, like a lot of other businesses, only keeps a day or two of supplies on hand, and then has to rely on outside vendors and then the government to bring in additional supplies.
Dr. Jay Doucet joining us from San Diego. Thanks for your insights. Really appreciate it.